Hi, everyone. I'm Dr. Michael Richmond, a double board certified cardiothoracic surgeon. And today I want to talk to you about a certain type of cancer, which is called a sarcoma. So, what are sarcomas? Well, they're a malignant tumor, obviously, which means cancer, and they arise from mesenchymal tissues, which is a specific tissue that is responsible for the development of most body structures, and it occurs while we're in utero, which means in your mother's uterus developing. And these include connective tissues like fat and muscle and blood vessels and all your nerves and your bone and your cartilage. They're broadly classified into two main groups. The first one are soft tissue sarcomas, and the second group are bone sarcomas. While we hear about them a lot, especially social media, they're rare, and they account for approximately 1% of all adult cancers and up to 15% of childhood cancers. Believe it or not, there's over 70 different histologic subtypes, which is recognized in the current World Health Organization classifications. They can occur anywhere in the body. The most common locations for soft tissue sarcomas are in the arms and legs and the extremities, which is about 43%, followed by the trunk, which is your neck to your waist, intra-abdominal sites, retroperitoneal sites, which is behind your organs, inside your organs, and the head and neck. Bone sarcomas frequently occur in the long bones, like the femur and the humerus of your extremities, especially in children and young adults, but can also be found in what we call axial sites, like the pelvis, the spine, the scapula, the clavicle, particularly in older adults. So how is the diagnosis made? Well, it requires a multidisciplinary approach and is based on a combination of clinical, radiologic, and pathologic assessments. The essential steps include a history and physical exam, which is necessary in every doctor encounter, imaging of the primary tumor, where an MRI is preferred for soft tissue masses and a CT scan for retroperitoneal or intra-abdominal masses, and we often do chest imaging for staging because there's a high risk of lung metastasis. Then we go on to a biopsy. Usually a core needle biopsy is preferred. However, as a surgeon, sometimes we need to do an incisional biopsy if it's hard to get to, and we know that after imaging is done. Then pathologic evaluation by an expert sarcoma pathologist needs to be done using morphologic assessment as the gold standard, supplemented by immunohistochemistry and molecular genetic testing when indicated. Then they do ancillary studies like cytogenetics, fluorescence in situ hybridization, which is a genetic test used to find and map specific DNA sequences or entire chromosomes, and something called polymerase chain reactions, and definitely next-gen sequencing, which I've talked about and done a video, is extremely important and used to identify specific genetic alterations, which can aid in diagnosis, classification, and ultimately treatment. Now, sarcomas are primarily a surgical disease. In other words, the best hope for cure is to operate and to remove everything. It's a big operation. But the question is, do people get any benefit from radiation, chemotherapy, immunotherapy, or targeted therapy? So I'll touch in summary. Radiosensitive include myxoid liposarcomas and synovial sarcomas. Immunotherapy responsive are undifferentiated pleomorphic sarcomas, dedifferentiated liposarcomas, angiosarcomas, some type of fibrosarcomas. Chemo-responsive are high-grade sarcomas, synovial cell sarcomas, leiomyosarcomas, and less responsive would be like a chondrosarcoma from cartilage. But those are briefly, different types. And obviously, the most important thing is if you have a sarcoma, or if you're diagnosed with a sarcoma, that you really go to an NCI approved cancer center and you go to sarcoma specialists, because you need that whole multidisciplinary approach. Okay, it's not a one-size-fits-all, and you need medical oncologists, radiation oncologists, great pathologists, and also probably a great surgeon. So with that, I hope you learned something today. Thank you so much for listening. For more information, guidance, advocacy, or a consultation with me, especially if you have a sarcoma or any other type of cancer, please go to my website at www.paladinmds.com, and thanks for listening.